There are two main structures that protect the spinal cord, the vertebral column and the meninges, which we'll discuss a little bit later on. These not only protect the spinal cord, but they also provide physical stability. Here we can see a picture of the spinal cord, and what we're going to focus on right now are the meninges. The meninges are three layers of connective tissues that encircle the brain and the spinal cord. Around the spinal cord, they're referred to as the spinal meninges, and these three layers around the brain are referred to as the cranial meninges. Meninx is the singular form of the word. The most superficial meninx is the dura mater, which we can see here. External to what we can see here is a cushion of fat and connective tissue in a space called the epidural space. This is a space between the vertebral column and the dura mater. This helps also to protect the spinal cord. Here we can see the epidural space, the space which contains the fat and connective tissue. The arachnoid mater is the next layer in. Projecting deep to the arachnoid mater is a spiderweb arrangement of delicate collagen fibers and some elastic fibers. This is not really shown very well here, but there is a space that's deep to the arachnoid mater between here and the next layer called the pia mater. And this space is called the subarachnoid space, and we'll say more about that a little bit later on. The reason this is called the arachnoid mater is because the word arachnoid means spider. The pia mater is the innermost meninx. This is a very thin membrane that adheres to the surface of the spinal cord and the brain. As mentioned earlier, between the arachnoid mater and the pia mater is the subarachnoid space. It's very important to know this next point, and that is that in this subarachnoid space there's a fluid called cerebrospinal fluid. This fluid acts as a shock absorber. The brain and the spinal cord are also suspended in this cerebrospinal fluid, so in essence your brain is kind of floating in the cerebrospinal fluid. Let's discuss a couple of clinical items that are related to the spinal cord. Removal of the cerebrospinal fluid from the subarachnoid space is called a spinal tap or lumbar puncture. This procedure is used to diagnose pathologies, that is diseases, and to introduce antibiotics, anesthetics, and chemotherapeutic drugs. What will happen is, in order to have a spinal tap done, they'll have a person lay on their side and bend over into a fetal position. This will increase the distance between the spinous processes of the vertebrae so that a needle can be inserted into the subarachnoid space. The spinal cord ends around the second lumbar vertebrae. However, the spinal meninges extend to the second sacral vertebrae. Between the vertebrae L2 and S2, the spinal meninges are present, but the spinal cord is absent. With the spinal cord not extending down as far as the spinal meninges, it allows the doctor to remove cerebrospinal fluid without puncturing the spinal cord. So a spinal tap is normally performed in adults between vertebrae L3 and L4, or between L4 and L5. Another clinical topic that relates to the meninges is the disease meningitis. Meningitis is an inflammation of the meninges, and it can be either bacterial or viral in cause. And you can learn more about this in a section at the end of the chapter.